Hello everyone, I hope all of you are doing really well. Today I would like to talk about a very important cardiology concept which is being tested in various medical exams over the years. And personally speaking, I can anticipate few questions from this topic for my MRCB part 2. So without wasting further time, let's dive straight into it. Well, did you know that there is a silent killer which is sitting right inside your heart and you won't know anything about it until it's too late? Yes, I'm talking about left atrium enlargement. Now, before we move on to this, let's have a quick recap of the normal anatomy of left atrium. So, the left atrium, as a chamber of the heart, will receive the oxygenated blood right from the lungs through the pulmonary veins and will push the blood into the left ventricle through the mitral valve. So, there are few conditions which can lead to left atrium enlargement, and I can think of few of them at the top of my head, which will be include your systemic hypertensions and your mitral valve diseases. Now, what happens if the left atrium enlarges? Now, if the left atrium enlarges, the normal blood flow is disrupted, and that can lead to a clot formation. And from that clot, there can be microembolies, and that can lead to a devastating complication, which has a very high mortality rate. Correct, that's stroke. There are other few conditions which also is associated with left atrial enlargement, which will include your atrial fibrillations and your atrial fibrillations or your arrhythmias, and the second thing is your heart failure. Since left atrial enlargement does not have any clinical signs, it does not have any warning signs, so we need to have investigation which can pick up. So the two topmost investigations which are very cheap and relatively easy to perform will be your chest x-ray and your ECG. So I'll talk about the ECG. But before that, I would like to talk about the chest X-ray. So in the chest X-ray, look out for something called a double contour sign or a double density sign. I would like to urge everyone to take a look at it. Now in ECG, there are few things which we need to take a look at. Your P wave. Now we know the P wave is for atrial depolarization, which means that the atrium is contracting. Now, if the left atrium is enlarged, you can expect something like a broad P wave. Normally, the P wave is less than, it's less than 3 small squares. So if there is a broad P wave, it will be more than 3 small squares, which will include that it will be more than 0.12 seconds. So it's very important that we look for a broad P wave. There's something also called a notched P wave in lead 2. We can also look for a notched P wave, which will be like a cute M-shaped P wave. So collectively, the ECG changes which can take place specifically within the P wave will include a broad P wave and a notched P wave. So this, and it's together collectively, it's called P mitrale. So it's very important that we look at for this ECG signs. So that's it about the left atrial enlargement. Please like, share and subscribe, and I'll see